Welcome to this explainer. Today, we are decoding the sometimes confusing world of IV needle sizes, color coding, and flow rates. If you've ever stared at a fully stocked IV cart and felt a little, overwhelmed by that giant rainbow of options, you're definitely in the right place. We're going to take all this essential clinical data and transform it into something you can easily visualize, understand, and, most importantly, memorize for good.
Okay, let's run through exactly what we'll be covering today. First, understanding IV gauges. Second, large gauges for emergencies. Third, standard gauges for adults. Fourth, small gauges for fragile veins. And finally, a really brilliant color memory mnemonic.
All right, part 1, understanding IV gauges and the inverse rule of needle sizing. So when we talk about inserting an IV, pretty much everyone just says needle. But here's the thing. The needle's only job is to pierce the skin and access the vein. What actually stays behind is the cannula. The source material has a great way of picturing this. Just think of the cannula as a tiny plastic straw resting right inside the vein. It's the diameter of this specific little straw that we're actually measuring when we talk about gauge size, and it's what lets us deliver fluids, meds, and blood directly into the patient's system.
And this brings us to the absolute golden rule of gauges. It operates on an inverse scale. Basically, the lower the number, the bigger the thickness and diameter of that plastic straw. Conversely, a higher number means a much smaller diameter. It feels completely counterintuitive, right? But it's a vital clinical insight. Think about it. If your patient needs a blood transfusion, there's no way you'd want to force that thick blood through a tiny, high-number 24-gauge cannula. The pressure would literally burst the red blood cells, totally ruining the transfusion. You absolutely need a lower number, larger gauge for that.
Which leads us perfectly into part 2, large gauges for emergencies, offering massive flow for trauma settings. Now, what's really fascinating here is the sheer difference in volume between these sizes. Obviously, flow rates are approximate depending on the specific manufacturer, but the maximum flow drops off a cliff as that gauge number goes up. We're talking about going from a massive 240 milliliters per minute all the way down to 90. In a severe emergency, those numbers literally mean the difference between life and death.
Right at the very top of the scale is the massive 14 gauge. This big guy is color-coded orange, and it pushes an unbelievable 240 milliliters of fluid every single minute. That is a ton of fluid. Because it's so incredibly large, you're not going to see this being used for everyday routine care. It is strictly reserved for those intense emergency trauma situations where a patient is crashing and you need lightning-fast administration of blood, medications, and huge volumes of fluids. Just a step down from that is the slightly smaller 16-gauge, color-coded gray. This one still delivers a massive 180 milliliters per minute. It's heavily utilized for really fast administration in high-acuity environments. Think surgery, severe trauma, or the ICU. Actually, if a patient is rolling into the operating room for a major procedure, the anesthesiologist is going to be incredibly happy to see a 16-gauge gray already in place.
Moving right along to part 3, standard gauges for adults. These are your everyday clinical workhorses.
First up in our standard lineup is the 18-gauge universally color-coded green. It flows at roughly 90 milliliters per minute. This is such a highly versatile size. Here's a great clinical pro tip for you. It's large enough to be perfectly safe and effective for blood transfusions and rapid fluid boluses. Plus, it's often the minimum requirement for certain imaging procedures, like a CT scan with a pulmonary embolism protocol, because that thick, high-pressure contrast dye needs to be injected super rapidly right into the antecubital area. Stepping down one more size, we've got the 20-gauge. This one is pink and offers a really solid 60 milliliter per minute flow rate. Honestly, this is probably the most common IV size you're ever going to encounter. It is the absolute standard for routine IV fluids and your everyday meds. While some hospital protocols might technically let you carefully transfuse blood through a 20-gauge, it really shines as the ultimate go-to choice for a stable adult patient hanging out on a general medical surgical floor. All right, on to part 4, small gauges for fragile veins. This section is all about gentle care for delicate systems. Getting into those higher numbers, we find the blue 22 gauge. It pushes a fairly modest 36 milliliters per minute. Because it's noticeably smaller in diameter, it is the absolute favorite for delivering fluids and routine meds to elderly patients, who, as we know, often have really weak, easily collapsible veins. It's gentle, but still totally functional for basic hydration and antibiotics.
But hey, what happens if that 22-gauge vein just keeps blowing? Well, if you're struggling to get access, you simply step down to the yellow 24 gauge. This little one delivers about 20 milliliters per minute. It's absolutely perfect for fragile pediatric patients or older adults who just don't need large, rapid volumes of fluids. It's tiny enough to slide right into very fragile veins without causing excess trauma to the vessel wall. Finally, we hit the absolute smallest one on our list, the tiny 26 gauge. It's color-coded purple, and it has a really slow flow rate of just 13 milliliters per minute. You're almost never going to see this in standard adult care. It is strictly used for the incredibly tiny, damaged, or super fragile veins of neonates and very small pediatric patients. When we put it all together and map the specific patient scenarios to the ideal gauge size and color, you can really see how perfectly structured this whole system is. Emergencies get the orange and gray, standard adults get the green and pink, and our much more fragile patients get the blue, yellow, and purple. And finally, part 5, the color memory mnemonic. Let's make this data stick. I know, memorizing all these numbers and colors can definitely seem a bit daunting at first, but the source material gives us this incredible rhyming mnemonic that makes remembering the whole thing an absolute breeze. We'll start with our massive trauma needles. A big 14 is orange like a tangerine, but 16 gray is used in surgery all day. Just picture that bright orange tangerine for the largest size, and the cold, gray, sterile environment of an operating room for the 16.
Now moving on to our standard clinical workhorses. Next is 18, which is looking kind of green, but a 20 pink delivers meds without a blink. Green means go for those rapid fluids and blood, while pink is your super reliable, everyday medication deliverer that literally never misses a beat.
Dropping down to our fragile veins, size 22 looks a little sad and blue because the smaller vein fellas prefer the 24 yellows. Sad and blue makes perfect sense for frail elderly veins, right? Well, the even smaller veins step right down to that bright yellow 24 gauge.
And finishing off with the tiniest needle of them all, and a purple 26 can always work great, especially when your patient is a neonate. It's such a fun, simple little rhyme, but it completely maps out the entire clinical sizing spectrum from 14 all the way down to 26.
So with that rhyme safely in your back pocket, you are completely equipped to recognize IV capabilities instantly, literally just by glancing at the plastic hub. Let me leave you with a quick challenge. The next time you see an IV in the wild, whether that's in actual clinical practice, on a medical TV show, or anywhere else, what color is it? And more importantly, what exactly does that tell you about the patient's condition?